We will start the next question. So let's read the question stamp. A 61-year-old man who is a dentist comes to the physician because of chest pain with exertion. He says that he has been in excellent health his whole life and does not smoke or drink. In addition, he jogs 2 miles. Both of his parents lived into 90s and died of natural causes, and his 3 siblings are alive and well. His blood pressure is 160 over 94, pulse is 74 per minute, and respiration are 16 per minute. Physical examination reveals regular S1, S2, and S4 is heard. There is a systolic crescendo-decrescendo murmur, okay, at the right second intercostal space radiating to the carotid arteries. An ECG shows left ventricular hypertrophy. Which of the following is the most appropriate to confirm the most likely diagnosis? This is very easy question, and you see such questions on your exams day. Not every question is hard for you, so let's go through the options. A, cardiac catheterization. No, it's wrong. So B, exercise stress test. This is also not right. Pulmonary artery capillary wedge pressure measurements. No, we don't need that. Thallium stress test. No, we don't need this too. Transesophageal echocardiogram. I think this is the right answer. So um, let's dissect the question. Why is it the right answer? So basically what this patient has, so she has like chest pain with exertion. He's never smoked, never drink in his whole life. His blood pressure is like 160 over 94. So physical examination and S4, so that means and S4 means there is some ventricular hypertrophy of the heart. So the murmur is typical of space radiating to the carotid. It's typical murmur, classical finding when you have aortic stenosis. Yes. So this is so whenever you have valvular disease, heart disease, or you have heart failure, any like aortic stenosis, mitral stenosis, you have to order an echocardiogram. So this should be on your fingertips whenever any valvular pathology. So what test we are going to order, that is echocardiogram. So thallium stress test not needed right now because mostly it is done when you want to see any ischemic heart disease, like if the patient has acute coronary syndrome or like angina. So these symptoms are more related to the aortic stenosis. So when the heart cannot pump the blood efficiently due to the stenosis or due to constriction of heart outlet, the aortic constriction, so you cannot pump enough blood. So when you exercise or exert yourself, so you feel chest pain or you can feel shortness of breath. Either you also can sometimes feel presyncope or you pass out. So these are the symptoms. So S4 is heard because due to aortic stenosis, the heart has to work more. So the cells, the myocardium, adapt itself to it becomes hypertrophied. So that is why an S4 is heard. So this is the classical murmur, and there is another hint: 160 by 94. So systolic blood pressure is way high, and diastolic is not that much high. So the pulse pressure, it increases. Like systolic, it's high, diastolic is lesser. So the pulse pressure also increases. It happens with aortic stenosis. So whenever you have any valvular pathology, valvular disease, you need to order transesophageal echocardiogram. Okay, so let's go through the explanation. So the correct answer is E. The patient's systolic crescendo-decrescendo murmur suggests aortic stenosis. That is correct. The murmur to the localized to the right upper sternal border, coupled with his symptoms of angina, specifically suggests this diagnosis. This patient's anginal symptoms are caused by increased demand placed on the heart caused by increased afterload. So because the heart has to work more, as I described earlier, the outflow, the aorta, that is the main pipeline through which the heart is going to pump out to the whole of the body. If it shrinks or if it is stenosed or something is blocking there, so that's mean the heart has to work more. So that is the afterload. So it increased the afterload and hypertrophied left ventricle seen in the patients who have aortic stenosis, and it is very common in this age group. Yeah, um, due to the calcified aortic wall. So echo is the most effective test at demonstrating the valvular region, cross-sectional aortic wall diameter, and severity of left ventricular hypertrophy. So yeah, you get to see these to reach at the treatment plan. So if echo is the initial test, transthoracic over transesophageal, the one in which you enter the probe through the esophagus and then you see from inside from that angle. So we prefer the easiest one, the less complicated one early. So transthoracic echocardiography is the initial test. Moreover, in the emergencies, you also have, if you have two options like transesophageal or transthoracic. So if the case is different, if it is some kind of emergency, so you need to order transthoracic echocardiograph. Okay. However, as this is not listed as an option, so transesophageal echo is the best choice. Yes, this is not an emergency case. Uh, so here you can order the most, if that would be the option, so you need to select that. But I was talking about if there is some kind of emergency, like if the patient is hypotensive, if there is aortic rupture maybe, or there is like patient is very um, moribund or something, patient is not he's getting decompensated, so you have to immediately order something that is done at the bedside. So immediately you need to choose transthoracic echo instead of transesophageal echo. So cardiac catheterization is appropriate in the evaluation of aortic stenosis. So if surgery is being contemplated, it allows precise quantification of aortic valve area, left ventricular function. Sorry, I have to. So that is okay. Cardiac catheterization is appropriate in evaluation of aortic stenosis if surgery is being contemplated. Okay, it allows precise quantification of aortic valve area, left ventricular function, and any coexisting coronary artery disease. As I told you, it can also be used in patients in whom echo is inconclusive or does not correlate with clinical symptoms. Okay, an exercise stress test may be appropriate for coronary artery risk factors, like after echo, if you think that this patient has classical symptoms of angina, or he is having he is a smoker, he has history of exertion during rest, or so you need to assess the risk factors. If there are more risk factors, then you can order the exercise stress test if the patient can exercise. But in this case, the patient has no risk factor of ischemic heart disease or coronary artery disease, so we are not going to order the exercise stress test first you need to do echo, and then you have to order exercise stress test if you're still suspicious about um, you know ischemic heart disease. So pulmonary artery capillary wedge pressure, it measures the pressure in the all the ventricles, atrial pressures, pulmonary artery pressure. So you can find out the cardiac output. So it is not indicated in the outpatient assessment. So, and also the thallium stress test is a nuclear medicine imaging study that evaluates for hypoperfusion areas like this test. So, if the patient cannot exercise like these two tests, and the patient has risk factors of ischemic heart disease or coronary artery disease, then you can order this stress test to the one patients who cannot exercise. So thank you. We will come up with more of these questions, but you need to give me the feedback so I can improve myself, and I can, come up. You can come up with the ideas that you can teach like this way. So consider it as your own channel. So subscribe, comments, and tell me how I can improve. Thank you, everyone.